All right. All right. Is everyone good to get started? Okay. So I'm going to be giving a presentation today on medical terminology. And the first thing that I wanted to start with, are you okay? You got a seat? Too close? Okay, let me close the window as well. Yeah, let's close this too so you guys can see better. Is that better? Yeah. Okay. All right, just to reintroduce. Did everyone get to sign the form for the presentation? Okay. We'll make sure it gets around before the end of the presentation, okay? So I'm a first-year medical student. Guys, sorry. I'm a first-year medical student at Albert Einstein College of Medicine. I'm going to be giving a medical terminology talk. And so just to start off the presentation, how many people have ever been to the doctor's office and they said something that you didn't understand or they just didn't explain it? Yeah, I know I surely have had that experience as well. We all signed. One more here, Robert. So we're gonna just go down and break down some medical terms. So a lot of medical terms are rooted in Latin. And so there are some prefixes and roots of the words and also suffixes that can help you break down what a word means. Even if you have no idea, we'll go through some of these things to help you get a better idea of understanding some complex words. Okay. So the first thing that we're going to talk about is common medical prefixes. Prefixes is the beginning parts of a word, okay? And so I know this is a lot on the slide, but we'll break it down. Some prefixes can give you some information on location, the amount, the time of things, and some other really common occurring prefixes. So have you guys ever heard of like hyper or hypo? Does anyone know what hyper means? High. What about hypo? Low. Okay. And then have you ever heard of something that's like dis in front of it, like dysfunctional? Yes. Means it's not working properly, right? Abnormal. And then there's anti, which means against. Yep. And auto. Does anyone know what auto means? What does it mean? Self. Yeah, self. Like autoimmune system. Yeah. The immune system for yourself. Yep. And then there's things like location, like some can give indication of the location of something. So has anyone heard of intra or inter? So intra means within or inside of something. Inter means between. Okay, you guys are doing great. Like you guys all know this, but sometimes it's hard. You see words that are really complex and you're like, how do I even begin to understand this? But you're seeing that there's these parts in front of the words of the root that can give you an indication as to what they're trying to refer to. We also have like sub, which means below. I also, I see some people taking pictures. I have a PDF with all this information on it, so you guys can have it on your phone when you go to the doctor's office, and you can look at it if there's a word maybe you don't understand. Okay. And then para means near or beside. Okay. And so like the parathyroid is near the thyroid. That's another organ that's near the thyroid. We have epi, above, and peri, around. Like pericarditis is inflammation around the heart. So you see how we start to like piece apart what complex words actually mean. Then we have quantities. You guys have probably heard this in everyday life, but like mono or uni meaning one, bi meaning two, tri meaning three, quadri meaning four, and multi meaning many. And then there's sometimes prefixes like time, pre, post, neo, re. So pre, it means before, post means after. Sometimes you have neo meaning new, and then re meaning again. And then some other common ones that you've heard probably are like mal, like maladaptive, bad. Yep. Hemi meaning half, contra against, iso equal, hetero different, homo the same. Okay. So this is just some really common ones that can help begin to form your understanding of some complex words. Yeah. Equal. Yeah. Equal. Yeah. Like yeah. So I put all of like the prefixes here and what they mean to break them down, okay? And I have a PDF for you guys that you can have. We'll email it to you guys that has this information on it. So yeah. Any questions so far?
Where do we put an email address? Okay, you have it from the center.
The center has it. So people who've signed should be able to receive it. They also could just send it out to everyone. Okay. Any questions online so far? Okay, let's keep it moving then. Okay. So now we're going to move on to the ending of some words that can help you understand what's going on. So we have itis. Has anyone heard of like conjunctivitis, where there's inflammation? Inflammation. And then some terms end in osis, like an abnormal condition. Okay. And then there's some terms that end in emia. Have you heard of something like anemia? So what do you think emia is related to? Blood. Yeah, great. And then there's some terms that end in algia, like myalgia. Yeah. So what do we think that means? Sorry? Or pain, just generalized pain. So there's a lot of terms that end in algia, and that can be indicative of pain. And then there's ectomy. Anything that has the word ectomy at the end usually refers to something that is being removed surgically. So splenectomy, yeah, cholecystectomy, you know, the removal of something surgically. Okay. And then we have oma, like carcinoma. What do we think the oma is referring to? Like a mass or a tumor. Yeah, and we'll talk about that afterwards, because some people hear like something with oma or like a tumor and doesn't always mean cancer. Okay, so we'll break that down a little bit further. Then we have things that end in pathy, usually referring to disease. Megaly, meaning enlargement. So like you've heard of splenomegaly, maybe, means the enlargement of your spleen. Yeah. And then plasia, meaning growth or formation of something. And genic, meaning producing or causing, like carcinogenic, you know? Okay. Any questions so far?
Just like, what is the difference between disease and sickness?
Disease and sickness. So there are a bunch of different ways to categorize conditions. You can have something as a symptom, where it's just something, you're seeing something happen to your body, right? Thank you so much. Then there's a, oh, sorry. Osis, abnormal condition. Sometimes it can hint to that. Yeah, but you'll get a list of all these on a PDF to have. There are some exceptions, but this is something that you can try to look for to maybe try to understand something. Okay. Just to continue on your question. So there are sometimes symptoms, things that are happening to your body. Then there's sometimes there's a collection of symptoms where you have a condition, and sometimes it is a syndrome where you have a collection of these conditions that fit into a category. And then sometimes there's diseases where you know that something is being caused by something else. So it's very like minute details differentiating them, but they are like different terms. So you can be sick with something, but not necessarily have a disease.
But a disease is something that lasts or could be cured.
Sorry, like acute or chronic? Are you referring to that?
Or? It's a chronic, or it could be cured.
You can have an acute disease. Yeah. Yeah. You could people had COVID. They had the COVID-19. And that was a disease, but obviously it was acute, right? There are some long-term chronic effects, but yeah, you can. Diseases aren't differentiated, or like nothing is defined by a disease that distinguishes between if it's curative or not. Some diseases are curable, some diseases are not. Yeah. Yeah, no problem. Yeah, there are many diseases that are curable, and there are some diseases that are never going to be curable. You know,
sickness you can get cured.
Yes, sickness you can get cured, but you can be sick and have a disease. But just because you're sick doesn't mean you have something. You could just have a collection of symptoms. Yeah. Yeah, of course. Some sicknesses are chronic. Yeah. Okay. Any other questions? Nope. Okay, I'm going to move on then. So we're going to do some practices. These are some terms maybe you've heard of, but hypertension. Does anyone want to tell me what they think this means? Hypertension? High blood pressure. Okay. And then does anyone want to tell me what splenomegaly means? If spleno means spleen, what does splenomegaly mean? Yes. Perfect. You want to say it again? Enlarged spleen? Perfect. And then does anyone want to tell me what bilateral means? Mm-hmm. Perfect. And then does anyone? Both. Sorry? Bilateral would be like if both your arms had something going on or both your legs. Bilateral. Okay. Intravascular. Does anyone want to tell me what intravascular means? Intravascular. In the vessels, the blood vessels. Yeah, perfect. Inside the blood vessels. Okay. It was a good little practice run. Some other things I wanted to talk about were just common terms you probably have heard. I'll go through all of these. So we were talking a little bit about acute versus chronic. We're going to talk about what those mean. So acute usually means sudden and a short-term condition. Chronic, on the other hand, means long-term or lasting a long time, and it's an ongoing condition. Okay? And that varies from disease to disease, the criteria that you have to meet to be categorized as either acute or chronic. Okay? So it's different with every disease. Then we're going to talk about benign and malignant. You know how I said sometimes you hear tumor and people's minds sometimes jump, oh, it's cancer, you know? There is a difference. There can be benign tumors and malignant tumors. And so that's why it's really important to have that conversation with a doctor if that ever comes up. Okay? So benign means not cancerous. And then malignant means cancerous. Okay?
Only cancer.
Benign and malignant, it could refer to other things outside. But particularly in this case, we're talking about cancers, okay? Okay. And then we're going to talk about inflammation. We hear inflammation every day. Everyone's talking about inflammation nowadays. So what is inflammation? Does anyone want to tell me what they think inflammation is? Okay. Okay. So we're hearing swollen. Anything else? Any other? I'll go through it. So inflammation, basically we all have immune systems, right? We have cells that are protecting our body against diseases, foreign pathogens, everything. It's trying to help maintain our health. And so our immune system will try to remove things that are harmful, whether that be a bad cell that could be potentially turning cancerous, or whether that be you getting like the common cold. Our body wants to protect ourselves. And so it reacts to harmful stimuli, and it causes a reaction that causes redness, swelling, like you guys were saying, heat and pain. Okay, so that's what inflammation is. It's just your body responding to harmful stimuli. Okay, any questions on that? Any questions in the back? Okay. Okay. So now we're going to just go through some things you probably have heard. And one of those things is, has anyone ever said you're MPO or you can't have anything by mouth? Why is that? Do you guys ever think, oh, well, why is the doctor telling me I can't eat lunch or can't drink before a procedure? Yeah. So MPO stands for nil per os, nothing by mouth. So nil per os is the Latin term, but it means nothing by mouth. And so there are certain situations where a patient is told that they are MPO. That means you can't eat and you can't drink. Some situations where you'll be in where you have that is sometimes when you're going into surgery, doing a procedure, sometimes you're getting blood work done and they need to have specific fasting so that they can make accurate measurements in your blood, okay? And so it's really important if a doctor tells you you can't eat to make sure that you, if you have questions, ask, but make sure you follow that so that you don't have any injuries or have any false results, okay? Okay. Now we're going to go on to some other big terms you probably have heard, and this is in relation to your heart and your circulatory system. So your heart and then how it pumps all the blood to the rest of your body. So you've heard of hypertension. We just talked about it. Anyone want to tell me what they said again? High blood pressure. Then we're going to talk about arrhythmia, stroke, aneurysms. Yeah. So we'll start with hypertension. Like you guys said, high blood pressure, hypertension. And so that's when the pressure of the blood against the vessels that carries the blood to your rest of your body, the artery walls, is too high. And that puts an extra strain on your heart. Because if the blood pressure is too high in the rest of your body, the heart needs to pump stronger and stronger. And eventually it can weaken because it's working so hard to pump that blood to the rest of your body, okay? And so normal, typically you'll hear is like 120/80. And sometimes there's abnormalities, and it's really important to follow up with your doctor if you are told that you have abnormal blood pressure, okay? Okay.
But this is sometimes it's according to the age.
Sorry?
The normal, the 120/80.
120/80, yeah.
Yeah.
So does anyone ever ask their doctor what this means?
At the top of the bottom.
The both of them. So the top is systolic, means when your heart is actually pumping.
Yes.
And then diastolic, the bottom pressure, is when your heart is just filling up with blood. And so there's going to be two different pressures that they're measuring. They want to make sure that both are within normal range. If it's high, there are medications that your doctor can give, and that's a conversation you have with your doctor. And if it's low, it's really important that you get medical attention. Okay? But there's some flexibility, and always follow up with your doctor if you have any questions, okay? Anyone have questions? No? Okay.
So what is a normal blood pressure?
Typically you'll see 120/80 as like the
Sam,
standard.
can you, for the people online, can you repeat the questions when they ask in the center?
Yes, of course. Someone asked, so what is normal? I mean, in textbooks, you'll see like the normal is like 120/80, but there's room, there's flexibility. There's a certain range that you can be within. And so if it gets really low, like below 100/60, that's when you start to get concerned. And if it's like above 130 and above 90 on the bottom, sometimes it's a little concerning, but you always follow up with your doctor and have a conversation with them. Okay? With any results you get, sometimes there's like a range that you have to look within.
I guess it depends on the physicalness of the patient.
There's a lot of factors that go into interpreting results that you get. Some people have other conditions that could be causing something happening. And so there's a bunch of things that go into deciding how you're going to manage whatever results you get. Okay?
But the heart rate is not the
Heart rate, so someone's asking, is heart rate similar to this? Heart rate is related but different. Different, okay? Heart rate is how many beats per minute your heart is pumping. Blood pressure is how much pressure is building up to get your blood across to the rest of your body.
And the pulse, when they say your pulse should be between less than 90, when you're doing your blood pressure.
Yeah. The heartbeat, you don't want your heart to be really, really fast when you're resting. So yeah, it's different. It's a different thing. So we're talking about heartbeat and like the heart rate and how it relates to hypertension. Okay. So the next thing, some of you guys were talking about arrhythmias. So arrhythmia, like you guys were saying, is when the heart beats in an irregular way. Okay. It's either beating too fast, too slow, or all over the place. Okay. And so a heartbeat that's too fast, you'll hear someone say tachycardia, too fast, okay? If the heartbeat is beating too slow, you'll hear bradycardia. And then if it's irregular, irregular means that the heartbeat is all disorganized. Sometimes it's fast, sometimes it's slow, it's all over the place, okay? Okay. And typically a heartbeat that is too fast is over 100 beats per minute when you're at rest. But obviously, if you just ran a marathon and you're sprinting super fast, it's a different situation, you know? So it's all in context. And then lower than around 60 beats per minute at rest, sometimes is considered bradycardia. Okay. All right. Finally, we're going to talk about for this section is stroke. So a stroke is when the flow to the brain gets obstructed. It gets blocked. And then that can lead to a blood vessel bursting. And when a blood vessel bursts, there are cells that are going to die. So we have cells that are going to get disrupted and die. And that's what the effect of this is. And there's multiple types of stroke. Not every stroke is the same. So you can have an ischemic stroke, and that means a blood clot is blocking a vessel in the brain, and that's cutting off blood flow. So if you have a boulder in a road and it's stopping the cars from moving, the cars can't get to where they need to go, right? And say they had really important material that they needed on the other side of that road blockage. That's what this is like, okay? And then we have hemorrhagic stroke. And so that's different because that means that it's not just blocked, the blood vessel bursts at that point, okay? And it's causing bleeding in the brain. And then the final one is a transient ischemic attack, or otherwise called TIA. And that means a mini stroke, a temporary blockage that goes away, but it could be a warning sign. So you make sure you follow up with your doctor, okay? Any questions?
How do you know if you had a mini stroke?
I mean, there are some tests that doctors can do, but you'll need to like have tests done, or sometimes. That's a good question. Some people could be asymptomatic, and sometimes there can be signs. But it's really important if there's any concern of that to talk with the doctor. Okay. Okay. So I wanted to talk a little bit about diabetes. I know that that's something that you probably hear a lot about. And so there are some terms that you got to be familiar with. Hypoglycemia means what? Does anyone want to tell me? Low blood sugar. What does hyperglycemia mean? Yeah. And so if you have dysregulation of insulin or your body's ability to respond to sugars, sometimes you'll not be able to take up as much sugar as you need to. And that could lead to hyper, or sometimes your body is not producing enough insulin. And so there can be disruptions in the level of sugar that you're intaking and that you can use as fuel. So insulin, we were just talking about that. Does anyone know what insulin is? What is it? Okay. Okay. And does anyone know what it does in your body? Okay. Okay. It's great. So insulin is a hormone, like you're saying, which is a protein that acts like a messenger for the rest of your body. And so that helps. It's made by the pancreas, and it helps regulate your blood sugar levels. Okay. So when you eat, your body wants to use that food for fuel, right? It breaks down, but it needs to get into your cells to actually be used as power, as fuel. Okay, so insulin helps the sugar move into the cells and be used for energy. If there's not enough insulin, then what happens? What do you think happens if you don't have enough insulin? Yeah, you can't take the sugar in, right? So you can't take the sugar in and your body doesn't respond well. If there's too much sugar around, you can have damage to other organs. Okay. Any questions? Okay. Anyone have questions online so far?
I mean, when the people have to give it a shot, they'd be
There's different ways to manage diabetes, and there are some injections, but always talk with your doctor about what's available, because there's multiple ways that you can go about treating diabetes.
The usage of insulin.
Yeah. So the usage of insulin, yes. Do you have a question?
The purpose of insulin is to protect it. That means your pancreas is not working?
So in some cases, your pancreas is damaged and you can't produce insulin, right? If the pancreatic cells are the ones producing insulin, say there's a lot of damage to the pancreas and there's a lot of damage to those cells that are, their job is to produce this. If we have damage to that, then sometimes there's going to be dysregulation in the production of insulin, right? And so if there's not enough insulin, then you're going to have dysregulation of glucose levels or sugar levels in your blood, okay? Yeah, there are different types. So So one of them is you're born with an inability to produce insulin, and the other is you become like insulin tolerant or like intolerant. So then it's not like actually functioning the way that it's supposed to. Yeah, yeah, yeah.
That's the number 2.
Yeah, number 2. And so, like you're saying, there's a lot of different ways that someone can become diabetic. They can either be born with a condition or they can later in life experience that. And so that's really important why you understand what's actually happening here. Like what is going awry that you need to like focus on. And so there are a lot of different ways. Someone brought up a question about like management. It's really important that you talk to your doctor about the different ways to manage diabetes. And sometimes for type 2, there could also be like lifestyle changes that the doctor recommends. And so it's really important to have that conversation. Okay.
Question before we
Another
go on,
thing.
please. A
Oh,
question.
Yes.
Thank you. If a
Hi,
person,
Roberta.
hi. Thank you for being there. You're terrific. I just want to ask if a person requires insulin at a given time.
Yeah.
Is it possible? Is there the possibility of changing lifestyle that would eliminate the need for insulin?
That's a really great question. And I hate to do this, but I'm going to defer to your doctor, but I know that there are cases where if there's major life changes, that eventually someone will no longer require like management aside from like lifestyle changes with type 2. But if you're born with like a deficiency, that's a whole nother thing, right? Like nothing that you change is going to change the fact that you have a deficiency in something. And there's a lot of cool technology that's trying to be developed with gene therapy and all of that. And they're working towards that. But as of right now, to my knowledge, only certain cases where there could be really major lifestyle changes. But again, I'm going to say like, make sure you talk with your doctor if you have type 2 diabetes.
Thank you.
Yeah, of course. All right, so we're going to talk about the HbA1c test, or otherwise known as A1C, or the glycolated hemoglobin test. And so we were talking about a lot of sugars and stuff, right? And and also insulin. Another really important protein in our body is hemoglobin, right? Does anyone know what hemoglobin does in the body?
Brings oxygen.
Someone said red blood cells. What about the red blood cells? Yeah, it helps carry oxygen to your whole body, right? Right. The hemoglobin is what binds the oxygen, helps deliver it in the red blood cells to the rest of your body. Okay. And so there's this test, the A1C test, where it measures blood sugar if it glycosylates the hemoglobin. So it attaches to the hemoglobin. And so this test is trying to see the amount of hemoglobin that's coated in sugar. And so if you have let's take a ball and other balls sticking to it, if those balls that are sticking to it are the sugars, and there's a lot of sugars on a lot of these hemoglobins, then you're gonna measure the percentage of hemoglobin coated in this sugar. And typically that can give you information on if you're normal, pre-diabetic, or diabetic. And so typically pre-diabetes falls in between 5.7 to 6.4% of the hemoglobin being covered in sugar, where diabetes is above 6.5. Okay, and then the normal is below 5.7. And so this is a test that sometimes people run when they get their blood work done. So it's important to keep this in mind. Yeah.
Sister-in-law.
Yeah.
She get it at this every morning to see how the sugar is.
Yeah. So someone mentioned that their sister-in-law pricks their finger to test how their sugar levels are. So that's a different test. This test, the A1C, is looking. Oops, let me just not. Yeah. So that's a different test. That one, they're looking at the blood sugar levels, and they're doing it every morning to make sure that they're not hypoglycemic or hyperglycemic. They want to make sure that they're monitoring that. The A1C test is looking over at this doesn't this is in terms of how much of your hemoglobin is coded in this. So it's looking over a period of time. Like it doesn't happen instantly. And so this is gonna tell you in the last couple of months how much hemoglobin has developed this coating around it. Okay, but for that, they're looking on the daily to see, because your levels are going to fluctuate, whether you just ate a meal or like overnight, things change. And so that's a more daily test you want to do. Okay, does that make sense? Okay. So some other things I want to go through are medication terms. And so sometimes the doctor will give you a prescription and tell you, oh, take it like this. And so I just wanted to go through that. A dosage is the amount of medication you take, okay? And then they'll instruct you how often you need to take that medication, right? If they say take 2 pills, you're like, oh, do I take both of them in the morning? Do I take both of them at night? You know, so you got to make sure you follow the instructions clearly. And so dosage is the amount. BID means take it twice a day. TID means take it 3 times a day. And PRN means take as needed, okay? So sometimes the doctor will say, okay, I'm going to prescribe you Tylenol, a strong Tylenol, but take it as you need it, okay? And that would be PRN, okay? But it's really important when you're looking at your medications to make sure you ask the doctor, do I take both pills at the same time? Do I take one in the morning, at night? Make sure that you can figure that out, okay? Okay. Another really important thing is sometimes doctors will instruct you to take things with food, or make sure you take it on an empty stomach. And that's also really important because sometimes the absorption of the drug depends on if you've had food recently, or it could be lessen the absorption if you've taken some sort of food with it. So make sure you follow those instructions clearly. The final thing I want to do, I know this is terrible, I'm so sorry, it's so tiny. Is there any way I can make it a little bigger? This is a CBC, a complete blood count. And so when you go to the doctors for your annual, say, or if you need to get blood work done, they'll typically do a complete blood count. It's like a basic panel that they want to see to make sure they check the components of your blood. I'll explain everything, so there's no need to see it. I blew it up a little bit. Is that a little bit better?
Yes.
Okay. So let me see. We're going to first talk about red blood cells, okay? We talked a little bit about hemoglobin, right? Those are the proteins that help carry oxygen to different parts of your body within the red blood cells. So let me just see if I can minimize this. Red blood cells are indicative of how your blood is doing. So say you have bleeding, right? Then you can expect that your red blood cell count is going to go down, right? Because it's leaving your body. And a high count could sometimes indicate things like clotting or atherosclerosis, okay? And so it's really important to look at your red blood cell count. But what's even more important, you've heard of anemia, right? Some really important values to look at for anemia is hemoglobin and hematocrit. And those are these two right here. And so if your hemoglobin is low and your hematocrit is low, sometimes that can indicate an anemia. Okay, but everything I go through today, there are ranges like we talked about in the beginning, ranges of values that are normal, and then beyond those ranges sometimes can be abnormal. But it's all within the context of all the conditions and all the symptoms that you're having, okay? So keep that in mind. Another thing that you'll see is the mean corpuscular volume, MCV, the size of the red blood cells. So what is the size? What is the volume? Okay. And then one other thing that I want to point out is red cell distribution, RDW. And so, like I said, sometimes the cells can have different sizes, right? You want to know if all of them are really big, or if some of them are big and some of them are small, or if all of them are small, okay? And so this range, the distribution of width, can help tell you that, okay? And then reticulocytes, I know these are a lot of big terms. Want to make sure that we cover it. I have a sheet on this, okay? So you guys can look it over. The reticulocytes are new red blood cells. So you know these cells don't just like magically appear. They have to grow from something else, right? So the reticulocytes are the new blood cells, and this can indicate that there's some sort of maturation that's occurring. So say you lost a lot of red blood cells and you need to make more. You might see an increased reticulocyte count, okay? Next thing I want to talk about is white blood cells. So red blood cells and white blood cells are different types of cells in your body. White blood cells can help indicate if there's inflammation or an infection going. So if you have an elevated white blood cell count, it could be indicative of that. And then you can have a different part of the exam, which breaks down what types of white blood cells there are in your blood. And so there's a bunch of different ones. I'm not going to go through all of them, but that can help indicate if it's like a recent infection or if there's ongoing inflammation going on. Okay. The final thing I wanted to talk about is platelets. And so platelets are these things that help form clots in your body. And so if you have increased platelet counts or decreased platelet counts, it could be indicative of some things to be to keep in mind and consider. Okay.
Very little inflammation, isn't that the sign of cancer or not?
Platelets, not necessarily. It needs to be, you need to review everything as well as any other symptoms that you're having, like weight loss or anything of that nature. And then, like I mentioned, if you find a mass somewhere, it's not always cancerous. And so there's a bunch of different things that you need to look for before you can make a claim that something is cancerous. Okay. There are other types of cancers like leukemias and that are just in the blood, and these tests are really important to look at for that. Okay, so we're nearing the end now. I just wanted to summarize what we've done. We looked at a lot of the prefixes and the suffixes, breaking down words. I hope that was super helpful. And I hope that moving forward, if you have doctor's appointments, when they come across big words and maybe they haven't explained it, or you realize after the fact you want to try to understand it better, hopefully those looking at the prefixes and suffixes can help a little bit. And then hopefully going through all of this has given you a little bit better of an understanding on these complex medical terms and can help you form questions when you're talking to your doctor and understand and take charge of your health. Okay, any questions?
When, because since I'm going tomorrow to the doctor,
Yeah.
for the result of the blood test, and then this wonderful technology has all my things
Yeah.
it's within range, but some are in the center,
Yeah.
some are at the beginning,
Yeah.
and some are at the end.
Yeah.
Is it better to be in the center or doesn't matter?
So the question is about if I look at my blood work and I see that there are some values that are right within the middle of the range or some are on the upper limits of the normal range. There's a range for a reason, but like I've said, you have to take it in the context of everything else that's happening. Sometimes some people might have an upper limit of the range, and it could be something to like consider and take into consideration when making a diagnosis. But if you're within the range and you're concerned if you're on the upper limits, you could, yeah, you could always talk about it. But normal range, there's ranges for a reason because there's some flexibility on what's
nothing is red, everything is
yeah.
Thank you.
Yeah, of course. Any other questions?
It's a great class today. I love it.
Yeah, I'm happy. If there's no other questions, then I'll end the presentation now, and you can always come up and talk to me if you have any other questions. Okay.
One quick question, one comment, because I'm not there, so I can't talk to you or anybody else. I
There's
just
one more question online. One more question online, guys. Okay.
There is all of this knowledge is always going to be helpful.
Yeah.
But at the same time, something that I've done when somebody cannot come with me to a doctor's appointment, I will have them present through their phone, and they can speak with the doctor, ask questions on your behalf. And it is extremely helpful for people to know that there is another way of getting help and not to be alone with the doctor.
Yeah. So the point that Roberta's bringing up is that you can always have someone that you trust at a doctor's appointment who can help you ask questions and gather information. And so it's always important if you feel like you want to have someone there to bring them to your doctor's appointment so they can help you facilitate questions with the doctor. Okay. If you're not English, yeah. So that's a really important point. What's her name? Eva brings up a very important point. Say English is not your first language, or you know a friend whose English is not their first language, to have someone that they trust to help. But another really important thing is medicine is moving in a way where we can be more culturally competent, and that includes having translators that could help and interpreters help facilitate conversations. And so don't be afraid if if you're going to the doctor's office, to tell them ahead of time or tell them at the appointment that you need an interpreter or a translator to help facilitate those conversations. Okay? Okay, any other questions? All right, so that concludes the medical terminology presentation. Thank you guys for coming. Yeah, of course. All right.
Many thanks.
Okay. Barbara, is it okay if I conclude the video?
Thank you for the presentation.
All
Yeah,
right.
yeah, I'll stop the video.
Okay, thank you.
Okay.